This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. Free monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. For an application, call 944-8344. That's 944-8344. Or visit our website at www.vsh.org. vsh.org.
Well, welcome everyone. Aloha. Welcome to Castle Medical Center. Thanks so much for being here. My name is Beth David Ann. I'm the director at the Wellness and Lifestyle Medicine Center, which you're very welcome to visit when we're done here. We're up in the Weinberg Building, Suite 105. We thank you so much for coming, and we're very excited to have our guest speaker here today. I want to also acknowledge that we have Dr. William Harris, who is videotaping for the Vegetarian Society today. So we welcome all of you here, and with no further ado, I'd like to give a little introduction to our guest speaker, Caroline Trapp. She's the director of the Diabetes Education and Care of Physicians Committee for Responsible Medicine, a nonprofit organization that does clinical research, nutrition education, and public policy advocacy, including work to improve the U.S. school lunch program. We should applaud just for that effort right there. Caroline has 25 years of experience in the care of people with diabetes, the past 12 as a nurse practitioner. She is a board certified in diabetes education, adult primary care, and advanced diabetes management. Since joining PCRM in 2007, Caroline produced and was featured in the DVD A New Approach to Nutrition for Diabetes, which received the, and this is in quotes, favorable reviewed seal from the American Association of Diabetes Educators. She's lectured at professional meetings across the U.S. and in Shanghai, China, on the scientific and practical aspects of plant-based nutrition for diabetes, and created and implemented many innovative and educational programs for people with diabetes and healthcare professionals. She is co-author of an article on plant-based nutrition for type 2 diabetes in the January-February 2010 issue of the Diabetes Educator, and she was a finalist for the 2009 AADE Diabetes Educator of the Year Award. We're so fortunate that she just happened to have a trip planned to the Marshall Islands, and just happened to have a couple days layover in Hawaii. So her colleague, who many of you might be familiar with, Brenda Davis, who's also an author of several books on this and similar topics, encouraged her to contact us, and want to also acknowledge that with many things from Karen Schmaltz in the audience, who really helped pull this all together as a accredited program for us today. So let's give a nice warm aloha to Caroline. Oh my goodness. Thank you.
Well, I've heard this is a tradition, but it really happens. Thank you very much. It is my pleasure to be here. This really is such a treat. I'm leaving snow and gray skies in Michigan, so it really is my honor and pleasure to be here. I want to thank Beth and Karen and everybody who's worked to make this happen today and to get the word out. I'm very excited to talk to you about what is really my favorite subject, and that is nutrition for diabetes. In my years as a nurse practitioner, first as a diabetes educator in a hospital, and then more recent years as a nurse practitioner in primary care in Michigan, I've had the opportunity to get to know many people with diabetes and to work with them over many years. And it's been frustrating to see the limitation of the therapeutic treatments that are available, and it's really exciting to have a lifestyle intervention that is effective. So I want to share with you some new research, and I'm hoping that some of this information will be new to you. I have to say I already had the chance to peek a little bit into what's available in your hospital cafeteria, and I know that this particular institution is already light years ahead of many institutions in terms of offering healthy food and having a wonderful wellness center and really a focus on how lifestyle can make a difference. But I hope to share with you some new research so that you can feel very confident in what you are teaching, and then also to consider some practical aspects of using that in practice. And then finally, I have some resources that I want to share with you and hope that you will use going forward. So let's begin just by talking about the common stages of how type 2 diabetes is treated. And this is the usual progression. Patients start, they come in, they're newly diagnosed, and they're told to start being more active and to follow a diet. And then we used to say do that for 3 to 6 months, right? And the current recommendation is that at diagnosis, people are started on a pill for their diabetes or started on metformin. That's a recent change in the last couple of years. Unfortunately, most people don't get cured with those interventions, so a second or a third pill are added, and then a single shot is added to that, and then the patient will progress to multiple injections. And of course, some people, depending on where they are when they're diagnosed, if their A1C is really high or they're suffering with a lot of complications or comorbidities, of course they might go right to insulin. But this is the common progression. And I put a circle up here at the top because these are tools that are utilized, of course, to recommend how people should eat. And the common approach to nutrition is one of portion control and weighing and measuring and learning how much of certain foods to eat. And as you'll see, there's another approach that we've been able to use quite effectively in research that doesn't require weighing and measuring, a nice option for our patients to have. So this is an algorithm published by the American Diabetes Association a couple years ago, and as you can see up at the top, this progression right at diagnosis, we start with lifestyle and then go to and add metformin right away for those who can tolerate it. So this is a lot of metformin that's being prescribed, with 10% of the U.S. population having type 2 diabetes. I think the latest number was 25 million people, and 8% are diagnosed. We still have a fair number of people who don't know they have diabetes, and of course most have type 2 diabetes. So how does this break down in terms of treatment? Well, the majority, this part of the pie, are being treated with some sort of medication, either just orals or just insulin or a combination of insulin and oral. About 16% of patients with type 2 diabetes are treated just with lifestyle. A large percentage treated with medication. Well, how's that working? What kind of outcomes are we getting? And unfortunately, I think there's room for improvement. 57% of adults with diabetes have achieved an A1C below 7%. Okay, so that leaves a fair number who are above 7. And on top of that, we have a large number who don't have good control of blood pressure and do not have good control of their cholesterol. And in fact, in this year's ADA Standards of Care, the statement was that only 12.2% of patients achieved all 3 of the goals, all 3 of the targets for management of type 2 diabetes. I love this cartoon. The government food pyramid must be working. More Americans than ever are looking like pyramids. And Dan Ferraro, the cartoonist, was kind enough to share this with me. And I think it's worth looking at the food pyramid that we're currently utilizing and teaching and questioning. Could we do better? And I think, as you'll see, there is certainly an alternative. Other choices besides more and more and more medication. So I'm going to talk about how science brings a new approach, and we're going to start just by thinking about population studies. And diabetes is rare in Asia and in Africa among those who follow traditional plant-based diets. However, diabetes is becoming more common as diets are westernized. We're doing a great job of exporting fast food all over the planet, or when people from those countries move to the U.S. And a good example is looking at the situation in Japan. So prior to 1980, in adults over age 40, only between 1 and 5% of people in Japan had type 2 diabetes. Well, what's changed in Japan? Fat grams have gone up and carbohydrate intake has gone way down. And how has that happened? Well, fast food has moved in. I took a trip to China 2 years ago with a delegation of diabetes educators, and Japan and China are similar in that they have this plethora of fast food restaurants, but this greeted us right outside the airport in Beijing. And it was interesting to me to note, now this is a group of Chinese students right in front of us, but the people who were in there eating KFC were not Americans missing KFC. It was Asian people who were in there enjoying their Kentucky Fried Chicken. And this is another thing that's changed. Milk was never traditionally a part of the Chinese or Japanese diet. You know, when you go into an Asian restaurant, usually milk and cheese are not on the menu. The availability of the use of cheese in menus across the country has gone way up. And cheese really is not a health food. It's really not all that different than butter in terms of its nutritional consistency. So what's come out of this really, unfortunately, is sort of a fear of carbohydrate. I have patients come to me all the time, newly diagnosed, and they say, well, I've given up the bread, I've given up the pasta, I've stopped eating fruit, as if those were the things that caused their diabetes. However, what we really see have changed is the intake of high-fat foods, unhealthy, saturated fat foods, and a lot of processed foods. And consequently, we've seen the rate of overweight and obesity go way up in Japan. And we've seen the prevalence of type 2 diabetes go from 1 to 5% to 11 to 12%. So a couple studies, and this will not be news, I don't think, to this group, but this is among one of my favorite studies to talk about, and I was excited to learn about this, and this is the Adventist mortality study. Now, this is an old study, but it looked at a large number of adults and looked at what kind of diet is more common in people who have diabetes. And first of all, just looking at who's overweight. Vegetarians were arbitrarily assigned the number 1, and when those were compared to non-vegetarian females and non-vegetarian males, you can see that those who were not following a vegetarian diet in men were almost twice as likely to be overweight, and the same is true for risk of diabetes. And this is age adjusted on the right side, but if we do age and weight adjusted, because we know that when people lose weight, they often are able to have less insulin resistance and avoid diabetes, but even with age and weight adjustment, they still had a much higher prevalence of diabetes. Now, a more recent study looked at over 60,000 individuals and looked at a specific breakdown of what type of diet led to being overweight and developing diabetes. So first, if we just look at the overweight, this breakdown compares those who followed a vegan diet, so no animal products at all, with those who followed a lacto-ovo-vegetarian diet. And by the study, that was defined as somebody who ate dairy and or eggs greater than once per month, as compared to pesco-vegetarians, those who ate fish greater than or equal to 1 time a month and dairy and eggs, compared to a semi-vegetarian who ate dairy and or eggs and meat greater than or equal to 1 time a month and less than once a week, and then the non-vegetarian who was consuming animal products more than 1 time a week. So you can see only the vegans were actually within the normal range for body mass index, and the more animal products that were consumed, the more the body mass index goes up. So what would you think would happen with incidence of diabetes? Well, it's the same. Prevalence of diabetes goes up right along with the progression in body weight with the amount of animal products that are consumed. Let's turn now to some intervention studies. And these are, I've got just a couple quick studies to show you. This slide looks at the effect of a low-fat, plant-based diet plus intensive exercise on the number of oral meds that were required for diabetes. Now, this was back in 1994, so I have to think it was probably just sulfonylureas, drugs like Amaryl and Diabeta and glyburide, those drugs. What was interesting, this was a short study, but a large number of people, 197 people, and after just 26 days on this regimen, only 57 still needed oral medication. In a study looking at insulin use, looking at a high carbohydrate, low fat, that was a plant-based diet, on just men with diabetes, they looked at, this is a small study, just 20 men were on a mean average dose of 26 units of insulin. Now, I don't know about Hawaii, but in Michigan, that would be a very low dose of insulin. And this was, again, just 20 people. It was back in 1979. So I suspect that this was probably a thinner group of people than what I often see in my practice. But after just 16 days on this diet, only 11 still required insulin, and the amount of insulin dropped by more than half. Now, in those studies, they didn't control for exercise, so it's hard to know how much was diet, how much was exercise. I want to show you one more study. This looked at neuropathic pain. And for those of you who have experience working with patients who have diabetic neuropathy, you know that that is a horrible condition to deal with. It's very hard to get good relief. This is a small study. It's just 2 weeks, but in this group, they were put on a low-fat, plant-based diet and encouraged to walk 30 minutes a day, not a huge amount of walking, but very significant outcomes. 17 became pain-free, and the other 4 had partial improvement. This is the intervention study I really want to spend more time with, because this study controlled for activity. And it's really a unique study in its duration and in the population it looked at. So this is a study that looked at a plant-based diet in comparison to the diet based on the recommendations of the American Diabetes Association. And it was conducted by the organization that I work with, the Physicians Committee for Responsible Medicine, along with George Washington University and the University of Toronto, and it was funded by the National Institute of Health. It was published in 2006 in Diabetes Care, the Journal of the American Diabetes Association. And actually a number of other studies have now been published on this particular study, looking at the clinical trial at 22 weeks, nutritional adequacy between the two diets, clinical trial at 74 weeks, so it went out for a year and a half. What was adherence and acceptability? We also looked at the practical aspects, and that's been published. So all good evidence that I want you to be aware of, that these articles are now available. So the study design was a vegan, low-fat, low-GI diet. Now, vegan, you know, is no animal products. Low-fat, in this study, people were encouraged to really keep total fat intake low, close to about 10% of total calories. So much lower than the usual. Often prescription diets are closer to 25 or 30% of calories from fat. And people were discouraged from using oil. So we hear that oil is a health food, but oil is actually very concentrated in terms of calories and fat. And the nutritional benefits really can be obtained from other sources, so which we can talk about. But in this study, people were discouraged from using oils in their salad dressings or sautéing. They were encouraged to learn how to sauté with water or vegetable stock. And then it was a low GI diet, low glycemic index, which we'll talk about. And that was compared to a diet based on the ADA recommendations at the time. And it was a 22-week study with a 1-year follow-up. And the dependent measures were A1C, weight, lipids, and urinary albumin. So the two different diets, just to, again, give you a little bit more detail, I talked about the low-fat vegan diet, but in the ADA group, they were instructed to keep saturated fat below 7%. And you can see the other guidelines here, but the other thing that was really significant about this group is in both groups, most of the participants were overweight or obese. Anybody in the ADA arm of the study that was overweight was instructed to cut their caloric intake by 500 calories. So they needed to be very aware of how many calories they were eating or how many grams of carbohydrate. And both groups were encouraged to take vitamin B12, just because many people are at risk of B12 deficiency, and we didn't want anybody to be low on B12, but people following a plant-based diet, long term, not usually just a year and a half, but after 3 years you may use up your store of B12. So for people following a completely plant-based diet, B12 supplementation is important. Okay, so the participant sample, now the study was conducted in Washington, D.C., so this was just a sort of a random sampling of the population. It was largely black and white Americans, very small number of Asians. Study participants were not compensated in any way. However, it was just advertisements in local newspapers, and we really got a cross-section of people on different types of medications. Some were on pills, some were on insulin, or a combination. And the protocol, now one thing interesting about this is that it was not an expensive study to conduct. Both groups got an individual meeting with a dietitian who had expertise in their assigned diet. There were weekly group meetings offered to both, and cooking demonstrations and cookbooks and all kinds of good resources. People were instructed not to change their exercise habits, and their adherence was assessed by 3-day dietary records and also by random phone calls, 24-hour recall. And medications were to be adjusted only in cases of symptomatic hypoglycemia by a clinician blind to group assignment, although as we came to find out, that's hard to do in a study where you're making lifestyle change with people who are on medications, and we had a lot of problems with low blood sugar. So for those of you unfamiliar with a vegan diet, this is what a typical day might look like. Breakfast might include, instead of bacon and eggs, might include oatmeal, or a high-fiber cereal with non-dairy milk, like soy milk or rice milk, and fresh fruit. One thing you'll notice about this meal plan is there's no portion sizes. So that's different for working with people with diabetes. And people really were instructed that they could eat as much as they wanted as long as it was just from these 4 food groups: fruits, vegetables, whole grains, and legumes like beans and peas and lentils. And nuts and seeds were allowed, but are really used more as a condiment. They might be put on a salad or in a stir fry. We wanted to discourage people from sitting down with a can of nuts and getting high amounts of fat from that. So this was a typical day's intake, and this slide just shows you how the diets changed over the first 22 weeks of this study, and how the 2 diets compared. So the red line is the ADA group, and you can see in both groups the total caloric intake dropped, as would be expected if you're in a study and you're working with a dietitian. Total caloric intake drops. Fat content dropped in both groups, but dropped much more significantly in the vegan arm of the study. Protein dropped in both groups, but I want to point out the ADA group had an average protein intake of 85 grams. The vegan group started with an average protein intake of 77 grams. It was really low. Most Americans get over 100 if they're including meat in their diet. But by the end of the 22 weeks, both groups had dropped, but look, the vegan group was only getting 51 grams of protein a day. Now that might seem low to some, but in reality the World Health Organization says that adult men and women only need between 45 and 55 grams of protein a day. And too much protein can be problematic and can cause kidney problems, kidney stones, lead to calcium loss, so this is actually a good thing. And then carbohydrate intake, no surprise, dropped in the ADA group quite a bit and went way up in the vegan group. So what kind of outcomes we're seeing with that? Well, but actually before showing you that, I wanted to talk to you about the Healthy Eating Index. How did these diets compare in terms of their nutritional adequacy? And there is a tool that was developed that is used to study how healthy is a specific diet. And it looks at a lot of different measures. And I want to reassure you that the vegan arm actually did very well, and in fact, in many measures, did better than people in the ADA arm in terms of increasing fruit and vegetable intake, nut and soy protein, cereal fiber, PUFAs to saturated fat ratio, and a significant decrease in trans fats. All right, so in terms of outcomes, A1C dropped in both groups, but remember I said that a lot of people had to change their medications because of low blood sugar. Conversely, some people, especially in the ADA group, needed more medication, and physicians who were not part of the study would sometimes make adjustments. So it's important when you're really trying to study the effect of diet on population that you control for that. So when we look at just the individuals who had no medication change, you can see that the people in the vegan arm, their A1C actually dropped 3 times as much as those in the ADA arm. And this scatter graph shows you the range of A1C drops. The blue, each diamond represents an individual with diabetes in the study, and the blue dots are those in the vegan group. And you can see they had A1C drops, average a little over 1%, but people dropped as much as over 4%. Whereas in the ADA group, it was clustered much closer to midline, and in fact, more people actually had their A1C go up over the first 22 weeks of the study. Now, the study continued out for 74 weeks. And this shows you what happened in terms of A1C. Both did their best at 22 weeks. It went up. But what's interesting is that the ADA diet was not hugely superior. And in fact, the vegan arm did a better job of maintaining a lower A1C. And again, when we look at hemoglobin A1C changes for those who had no medication changes, it was a bigger drop in those in the vegan arm. LDL cholesterol dropped in both groups, but more significantly in the vegan arm. And plasma triglycerides stayed about the same in the ADA arm, but dropped much more in the vegan arm. Now that's kind of surprising because remember, the vegan arm was taking in so much more carbohydrate. But one aspect of this study encouraged people to adopt a low glycemic index diet. And Dr. Barnard, the principal investigator of this study, really thinks that may be the thing that helped keep triglyceride levels low. People were discouraged from, they ate a lot of carbohydrate, but not white bread, white rice. They were eating sweet potatoes and lots of fruits and vegetables and greens, things that had a low glycemic index. Body weight dropped in both groups, and both groups were able to maintain it and to prevent going back up to their baseline weight at the end of 74 weeks. And urinary albumin, a measure of kidney function, dropped in both groups, but a little bit more in the vegan arm. So let me put a face on this for you. This is Vance. And Vance had some really significant outcomes. Now, coming into the study, I have to tell you, he was very disappointed to be randomized into the vegan arm. He is a police officer. I think he was 39 at the start of the study, the same age as his father, who died of heart disease and complications of diabetes. And he was a newlywed. So a busy guy, newly married, not real excited about adopting a vegan diet. But over the course of the study, lost 60 pounds. His A1C went from 9.5 to 5.3, and his doctor asked him to stop diabetes medication. And one thing he has allowed us to share with you is that he also came in during the course of the study and shared with the principal investigator that one other added benefit to eating this way is he discovered that his erectile dysfunction resolved. Mm-hmm. So, and I frankly think we are missing the boat, not talking about that side effect, beneficial side effect, quite a bit. I think we could get a lot more men who are very willing to adopt a plant-based diet. And in fact, the statistic is that 50% of men who have type 2 diabetes for more than 10 years have erectile dysfunction. So this is a significant problem. I mentioned the medication changes, and Vance was certainly one who was able to come off of his medications. I want to introduce you to another person in the study. This is Nancy. And Nancy had a really nice experience, too. She lost 40 pounds. Her A1C went from 8.3 to 6.8. She was able to stop 1 of 2 of her diabetes medications, and her arthritis improved dramatically. She was somebody who used to complain that when she tried to open a jar, it was really painful for her. And a few weeks into the study, one rainy day, she was struggling with a jar and noticed it didn't hurt anymore. And I will tell you, that was my own experience, and I hear a lot about this, that people who have chronic joint pain often find that I believe it's the dairy products. I know for me that was my issue. When I eliminated dairy from my own diet, my chronic joint pain went away. So I think, I don't have studies on this, but I have heard from many of my patients and from others that is something that they see. So an added bonus. All right, so what about adherence? How hard was this rigid vegan diet for people to follow? And these were these were the only criteria in terms of looking at adherence for the 2 different groups. And actually the vegan group did pretty well. They scored 78% or higher, in the high 80s or 94% in all of the measures for adherence. the ADA group, they were only asked to, we looked at 3 factors in terms of adherence, and where they really fell down, this is interesting, was with saturated fat intake. Now, why is it that that group had more trouble with saturated fat? And what we think might be is that when the focus is on carbohydrate, and you're told, when you're out at a restaurant, don't eat the basket of bread, but you're hungry and a big chicken breast is served. And of course, with this group, that's maybe not as much an issue. But for those people who are eating meat, that they're more inclined to eat, the whole chicken breast, or a larger amount of cheese, or getting some other source of saturated fat. So saturated fat intake went up. All right, number of meeting adherence, as I mentioned, this was much higher in the vegan group. Now, that's not to say that this is an easy diet to adopt, and there certainly are some big changes that are required. But what the study showed in terms of lots of measures in terms of acceptability and adherence was that people found after they got over that initial couple weeks of what am I going to eat, and with the support of working with a registered dietitian and being part of a group that was meeting and getting all kinds of resources that I'm going to share with you, people found, they learned what to pack for lunch. They learned what quick convenience foods to have in the pantry. They learned what local restaurants they could eat at. So they got used to it. And they got used to talking about it with their friends and family, so it didn't seem so strange. All right, so the study summary is that plant-based diets are effective for glycemic, lipid, and weight control, and that adherence compares favorably with a more conventional diabetes diet, and that the results were achieved with no limits on energy intake, carbohydrates, portion sizes, or without any change in exercise habits. And of course, you'd encourage changes in exercise at the same time, and we would expect that outcomes would be even better. So just to compare foods based on source, what is it about plant foods? Well, they have no cholesterol, they're naturally low in fat, they're low in saturated fat, they have plant protein as opposed to excess protein, which I mentioned is important in terms of kidney function. They're higher in fiber, and that probably adds a lot in terms of satiety and acceptability of this diet. When you're eating a high fiber diet, you feel full faster. Also, an added benefit is it's high in antioxidants, phytochemicals, and those foods, those nutrients that help to protect us from cancer. No hormones in plant foods that are added to keep the dairy cow producing milk, or hormones given to chickens to make them grow bigger faster. Low pesticides and toxins, because although plants are certainly sprayed, when people are eating animal products, they're getting the pesticides that animal consumed in a more concentrated form because they're getting more fat. Many plant foods contain calcium, whereas foods from animals promote a more acidic blood level, so there's more calcium loss. And then finally, I put in yellow here that plant foods promote regularity. And that is significant. Working in the primary care setting where I work, the doctors I work with joke about, it's not funny to the people who are suffering with this, but the number of office visits around constipation, this is an American epidemic, I think, related to nutrition. So that goes away pretty quickly with a plant-based diet. So why exactly does this work for diabetes? Well, we're not really sure. But some of the hypothesis is, first of all, we know in any diet where there's weight loss, insulin resistance goes down and blood sugar gets better. But in addition to that, with this particular nutrition approach, there was reduced saturated fat intake, and that's well known to reduce insulin resistance. Also, the glycemic index was lower, and in studies that just look at glycemic index, they control for everything else, A1C usually drops between 3 and 5%. So that certainly may have contributed. And I'm going to give you some examples of the low GI foods that people were instructed to eat. Also, this particular diet, plant-based diet, is lower in iron. And it's specifically, plants have non-heme iron, whereas animal sources provide heme iron. Well, what does that mean? Heme iron is stored by the body and may contribute to insulin resistance, whereas non-heme iron, our body only keeps as much as it needs. So that's another added benefit of plant-based nutrition, often we worry about people getting enough iron, but in reality, people on plant-based diets get adequate iron if it's a healthy, well-planned plant-based diet. And then another consideration is this reduced intramyocellular lipid. Anybody familiar with that term, IMCL? This is something new that I hope you'll hear more about. There's a limited amount of research, but what there is very interesting. And this intramyocellular lipid just refers to, it's a fancy name for fat inside the muscle cell. And I want to show you, if I were to stick a needle in your leg and pull out a skeletal muscle cell, this is what it would look like. And on the surface of the muscle cell, you have these glucose receptors. And when we eat, glucose from food is broken down and travels through the bloodstream, and it needs to get inside these glucose receptors and into the muscle cell, because glucose out here floating around in the bloodstream can cause problems. Well, in order for that to happen, these glucose receptors need to open up, and the way that happens is through the release of insulin from the beta cells of the pancreas, and it comes along and hooks up with the insulin receptors on the cell wall, which causes some intracellular signaling and allows glucose to enter the cell. Well, fat inside the muscle cell has been shown to interfere with this process. And we know that people who have a genetic predisposition, a genetic family history of type 2 diabetes, even before they're diagnosed with diabetes, have been found by CAT scan or MRI imaging that to have a higher amount of this fat inside their muscle cells. And people put on a very low-fat diet reduce the amount of fat inside their muscle cells. So there may be some implications here in terms of the total fat and maybe the kind of fat. Certainly saturated fat may be the most problematic in terms of getting at this, getting the fat out of the muscle cell and allowing the insulin receptors to do their job effectively. So if we're trying to limit the amount of fat in our diet, well, where does the fat come from? And I should have cheese and dairy up here, and I apologize, I don't. I've got all these different animal sources, but you can see why the general American population is getting way too much fat. And the leanest beef has 29% of calories from fat. Skinless chicken breast is very close, 23%, although people think chicken is a health food. Fish has a range. Trout and tuna are a little bit lower, but salmon can get up to 50% of its calories from fat. So not a health food. Now some will say, well, isn't it healthy fat? It's the omega-3 fatty acids. But do you know where the salmon get their omega-3 fatty acids from? It's from eating the plants, eating algae. And we can get our omega-3 fatty acids from plant sources as well, from beans, from walnuts, from greens. There are lots of other good sources. Many seeds have omega-3s. When you compare the animal sources to the plant sources, and you can see that plants do contain fat. You don't have to worry about eliminating all fat, but plant foods are just much lower in fat. And broccoli, beans, rice are all good examples of foods that are very low in fat. Sweet potatoes or yams only have 1% of their calories from fat until we take the potatoes out of the oven, right, and put sour cream or butter on them, and then it becomes a whole different story. I mentioned that low glycemic index was a consideration. The GI is just a measure of how quickly foods increase blood sugar levels. And you can buy whole books about the glycemic index of different foods, but it's not necessary to do that. And in this study, the participants were instructed just to know these high GI foods, sugar and white bread, most people were already aware of that, but most cold cereals, watermelon and pineapple, and baking potatoes. Now that's not to say that people should never eat watermelon and pineapple. I certainly don't want to say in Hawaii not to eat pineapple, but just to be aware for some people this can really spike blood sugar. And I do think in terms of importance, the vegan is probably the most important thing. That's where you're really eliminating the saturated fat. Limiting oils is probably secondary in importance. And then if somebody still is experiencing high blood sugars, then you might want to look at the glycemic index of foods and maybe even some specific foods, such as watermelon and pineapple. they were really encouraged to emphasize the low glycemic index foods. So these are beans, oatmeal, green vegetables, fruits, pasta. And pasta is always a surprise, but pasta has a low GI, unless it's cooked to the point where it's mushy. And then it just turns to sugar in the blood, just like white bread would. And then certain breads, white bread we know is high, whole wheat bread is surprisingly in the middle, and rye and pumpernickel breads have a lower glycemic index. So sometimes I hear from clinicians that this approach is so drastic. And I love this quote from Dr. Dean Ornish. You're familiar with Dr. Ornish. He was on the cover of Time magazine in 1990, and he was Man of the Year. And he demonstrated that a low-fat, largely plant-based diet could reverse heart disease in those who had very significant heart disease. And he said, I don't understand why asking people to eat a well-balanced vegetarian diet is considered drastic, while it's medically conservative to cut people open or put them on powerful cholesterol-lowering drugs for the rest of their lives. And I would say the same is true for diabetes. We ask people to prick their finger over and over, to inject insulin, to worry about low blood sugar, to take a big bag of pills. What is natural about that? That seems to me to be very drastic. And of course, unlike any other diet, the benefits of this approach go well beyond diabetes. And you can't say that about other nutritional approaches, but there's lots of good evidence that the results of this nutritional approach are very far-reaching. Now, will your patients make the change? And I like as this example, it wasn't that long ago that physicians were recommending smoking to their patients. And if you think about seatbelt use and bicycle helmet use, or Segway helmet use, as I'm seeing in downtown Honolulu, certainly social norms can change. And I think that we certainly are seeing more and more press about the problems with meat, the problems with dairy, and I think that the time is right. Certainly in Michigan, where I see people, and the medical insurance is no longer paying for so many prescription medications and the cost of office visits, and people are really interested. What can I do to reduce my healthcare costs and to stay out of the healthcare system? So I do think that there is potential. And I want you to feel confident that there's good support from the professional organizations. And this quote is from the 2003 American Diabetes Association Vegetarian Position paper, but their 2009 paper, if you haven't seen it, really is even stronger. There's 144 citations supporting the use of plant-based nutrition, and they specifically say vegan nutrition is adequate across the lifespan, safe for people, and specifically useful to prevent and treat many chronic diseases. And our friends at the American Diabetes Association have also made a similar statement. This is from last year, and I put it up just as a comparison. Last year, they made a statement that a low-fat diet, a plant-based diet, i.e. vegetarian, may be continued without a problem to blood sugars, that it's safe for type 2 diabetes. Not a real strong endorsement. But this year, the brand new, and they just came out in January, for those who haven't seen them, the latest issue of Diabetes Care that's published every January by the American Diabetes Association has a statement in the standards of care for type 2 diabetes that say a low-fat, plant-based diet has been shown to improve metabolic control. Now, we would encourage them to go on and look at the evidence about not just the safety and efficacy, but also the additional benefits to other concerns for plant-based, for people with diabetes, and the other benefits, such as the effects on weight control and blood pressure and cholesterol and other conditions. But there's progress. So you can feel confident that the ADA is saying that this is an effective approach. So how do you get started with this in practice? And these are recommendations actually that were used in studies, and I've been using in my own clinical practice. I continue to see patients 1 day a week in a primary care practice, and I have found this approach to be effective. Now, commonly you hear about this idea about small steps lead to big changes, or moving people along slowly, and that is one approach, and for some people that does work really well. And certainly that was my own progression to a plant-based diet. It didn't happen overnight. But we've also had good success with this approach, so I want to share it with you. And that's encourage people to take a week of planning. They're going to figure out what they're going to eat. They're going to get the problematic foods out of their house. Maybe they'll donate food. Maybe they'll invite over friends they don't like very much and clean out the freezer. They'll try out some recipes, and they'll lay the groundwork. And then for the next 3 weeks, they're going to give this 100%. And the really neat thing about that, and especially that's why I love working in diabetes, is that you see impact right away. And if they're monitoring blood sugars, many will see blood sugars get better. They'll see the scale go down. They'll find they have more energy. They're not waking up at night to urinate. I mean, they really do, if you really give it 100% for 3 weeks, many will see wonderful changes. Now, a couple of notes, and that's, first of all, I do want to point out that I'm not saying that this is a magic cure or that this will work for everybody. And I have had patients who really, I do believe, gave it their all. And their blood sugars didn't necessarily get better, but their weight got better, so they wanted to stick with it. Or they didn't lose weight right away, but their blood sugars got better. Or they were able to drop one medication, maybe not both of their medications, or whatever. So I've seen people have a lot of good outcomes. For those who are taking certain medications that can cause low blood sugar, of course you want to make sure they know in advance how to recognize and treat low blood sugar. And those who are counting carbohydrates and adjusting insulin to cover the carbohydrates, they're still going to need to do that. And in fact, their insulin to carb ratios may change a little bit. I find people need a little bit more insulin initially at mealtime and less insulin at bedtime, although that's not true across the board, and it really has to be individualized. So I encourage people to call me and follow up closely if they're taking insulin. I want to end just by sharing with you some resources I think you'll find useful. And I know thank you to Karen, who arranged for continuing ed credit for this presentation today. There's a wonderful website you can go to called nutritioncme.org where you can get free CE credit for programs on nutrition. And there are programs on diabetes, and in fact there are new ones going up all the time. There's a great program with Caldwell Esselstyn out of the Cleveland Clinic on heart disease. There are programs on cancer prevention and treatment, a program on cholesterol, weight control, lots of good things there. So check that out, and there's no charge for those. In addition, we've got a lot of great resources from PCRM, the Physicians Committee for Responsible Medicine, and I'm flashing this so you can see some pictures of these different resources, and you have them in your folders, but this Vegetarian Starter Kit is a 22-page booklet. It's just great. And we used to give it out free to healthcare professionals in bulk. This year, because we were giving out so many of them, we asked that people who request them become members of PCRM, just so we can keep in touch with you as well and let you know when we're doing programs like this around the country and new programs online. But for $20 a year, you can order unlimited amounts of any of these resources for your patients. The other is Diet and Diabetes Recipes for Success, and I keep this on my desk. It provides a great summary of what the science is with this approach, and then some recipes, the websites that I'll show you in a minute, and then on the back there's a list of ideas about low-fat meals and snack ideas. So that's a great tool. I use it in practice. It just takes a few minutes to review with a patient to get them started on this. So this is a list of various websites you'll want to check out. I mentioned Nutrition CME. NutritionMD.org is another great resource. Again, there's no charge. You can go online and you can do a week's menu, all low-fat, all plant-based, and it will even print out, you can print out the recipes and the grocery list to go with the recipes that you select. Also at NutritionMD, you can look up any chronic disease and find out what the evidence shows about different nutrition interventions for that chronic disease. And then lastly, there's pcrm.org/diabetes. That's a webpage that I maintain, great resources specific to diabetes. And foodforlifetv.org are weekly shows that feature recipes, cooking demonstrations, and discussions about nutrition for different diseases. And then a couple of my favorite books. How many have read The China Study by Colin Campbell? Great book. I give that out to the physicians I work with have all read it. One adopted a vegan diet right away. There's a movie coming out about this particular book in the fall. in the spring called Forks Over Knives. So you heard about it here first. And the picture that goes with the movie is a fork, a hand holding a fork with a scalpel underneath it. That's where the Forks Over Knives come from. And I think it'll be similar in feel to Food Inc., but it's specific to nutrition. And I think it's really going to help wake up a lot of people about the problem with our diet. Okay, so the other books here are good resources. Now, if you want to give this approach a try, or you want to share with your patients, get them excited about this, PCRM has been conducting a great program called the Kickstart Program, an online support group. It's a 21-day program, and we offer this. We did it in September, and we had about 10,000 people sign up. We did it again January 1st, and we had 45,000 people sign up. And we're doing it again starting March 1st. So you can go to this website and sign up, pcrm.org/kickstart, and every day you'll get a little reminder, some nutrition, pearl, recipes. A lot of celebrities have participated. We have Dean Ornish, we have Elisa Silverstone, the movie star and author of The Kind Diet. Colin Campbell is on there. A lot of great people. So it's a fun program to participate in. So I'll end by asking, do we want to wait for the treatments of the future, medications, bloodless meters, transplants of islet cells? And I would argue no, we don't need to do any of that. I know bariatric surgery is now approved and paid for the treatment of diabetes, but unfortunately it's really not a very affordable, sustainable solution for our population. So it's really nice to have an intervention that's low cost and very safe for our patients. So I'm going to end my comments there and ask, what questions do you have? Comments, experience with this? Any questions? Here, I'll repeat the question. The question was about physician acceptability for those people who were in the study. Did their physicians refer them, or how did they feel about this diet? And actually, patients self-referred to the study. It was just ads in the local newspapers in Washington, D.C., and many of their physicians got on board with this. You know, I can tell you about my own experience in terms of talking to physicians, and that's that many of them are frustrated with the side effects of medication. Their patients can't afford side effects. So more and more, I think, are really becoming interested in this. I also see some who are not very knowledgeable in nutrition, or who will dismiss this as, oh, my patients won't do that. You know, well, maybe your patients in Washington, D.C. will, or in Michigan, but you don't know my patients. But what's interesting is, as I travel around the country, everywhere I go, you know, I find that there are McDonald's, but I also find that there are restaurants where I can find vegan and vegetarian meals, and that I don't think there's any one unique demographic or population group that absolutely can't do this or absolutely will. I just think it's a matter of how we sell it. And that really is where our role is. You know, we're in a helping profession. The enthusiasm that we bring and our own experience that we bring can really make a big difference. Any other questions? Well, I'll end there. Thank you so much for taking the time. It's a beautiful day, and I appreciate you all being inside at lunchtime to come and hear. Oh, I do want to just end with one thing. I want to give a special thank you to Beth, David, Ann for setting this up, and I brought her a copy of our Nutrition Guide for Clinicians. This is published every year by the Physicians Committee for Responsible Medicine, and it goes through all of the different chronic diseases and the nutrition interventions that are recommended and have been studied. All of this information is available online at nutritionmd.org. But Beth, I wanted you to have your own copy. It's a little heavy for your lab coat, but I hope you'll enjoy using it. So thank you again.
Let's give her a nice one.
Thank you.
All right.
This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. Free monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. For an application, call 944-8344. That's 944-8344. Or visit our website at www.vsh.org. vsh.org.